Hi, my name is Helene. I'm a licensed massage therapist and physical therapist. I've been practicing since 2007, predominantly doing manual therapy work, which I absolutely love. Currently I'm licensed in Australia and the US, but living here in Gainesville, Florida. The thing I really like about working here at Clear Passage is the sort of profound impact we have on patients in a really short time. It's a luxury to have such condensed time with a patient and really see them through those nuances of changes that we can make even in the week that we have with them. Not very often do we have that chance to see patients and hear such personal stories. One of the things I think is quite unique with us having this condensed time and elongated time with patients is that we get to really dive deep into the patient's story about how they've ended up here and how they presented the way that they present. One of the common things that we hear is that patients don't often feel that they've been listened to as deeply as their story goes, and nuances are missed. And I think even from a psychological and emotional perspective, having that ability to share what's been going on with their lives is quite cathartic, and I think adds a really relevant healing impact to how they present at the end of the week, which is more positive. And I think it's important to allow the person to explore things that they maybe hadn't even thought were relevant. One of the most important things I think that we give patients is the ability to continue to self-treat when they leave here. It's taken a long time for them to end up in the presentation that they have when they arrive, and it's not always a case of being able to resolve everything 100%. So having the ability to go home, either by themselves or with their assistance of their partner or a loved one, to help self-treat, look after themselves, and have techniques that they can use to resolve flare-ups or increases in pain. And I think that is so important. It's one of the most important things I think we can give is self-awareness, that they learn about how their body's so connected and why the body presents to them in the fashion that it does, and then learning how to mitigate those presentations and move forward positively on their own. I think one of the main things that patients find here is that our focus is predominantly manual therapy based, but we have that one-on-one time with patients. They have 4 hours one-on-one with therapists every single day that they're here, and that's so different compared to a lot of other settings, both here in Australia, here in the US and in Australia. The emphasis in when you are dealing as a physical therapist with manual therapy, it is short sessions. You're lucky if you get 30 minutes. It's a lot on wanting them to come back, and not always necessarily getting to the root of the problem. And so there is this continued tie-in for the patients to needing therapy without resolving anything. And I think my motto has always been that, if I don't see a patient for a while because they're better, that's what I want. And that's what we want here at Clear Passage. We want the patient to leave here better. If they need us and they want to come back, that's wonderful. We'd love to see them. But if they can manage on their own once they leave, that really is the goal that we want. I think every patient we have is unique. Every presentation is completely different. The puzzle pieces of their life coming together present so differently. But the one thing I've noticed is first, meeting with the patient, there's always a lot going on. There is some apprehension. There is a sort of a nervousness about, what am I doing here? Why am I here? Have I done the right thing? What's going to happen to me? What's it going to feel like? And I think patients feel a little maybe reserved. And then obviously as the week goes on, we have further conversations, we have further dives into their history, and it's a big change, not only physically that we see in the patients during the weekend, but also emotionally and mentally. There is a brightening, a lifting of the person, both almost in spirit. You can see them changing how they feel about it, but also in enthusiasm, I think, and some clarity about how they're going to move forward. And I think that's a really nice positive thing that I really enjoy seeing, that really nice change. One of the things that I think happens because we have time with the patient, and we really continually asking questions as we treat, and we invite patients to talk to us as well. You know, if they want quiet time while we treat, then that's absolutely paramount. But there are definitely a need for patients to let us know what's going on with their body so that we can get to the root of what's going on. If the patient's a very passive participant in what's happening and just hope that it's going to passively occur to them, I think it doesn't always result in such a good response. I think obviously we make changes physically, but if the patient opens up and lets us in with what's happening as we're treating, then we can alter how we can treat. But also, I think from a mind-body connection, I think they're much more vested in the outcome at the end, which really affects how they leave. If they are vested in a positive outcome and they see themselves being a more positive, happier, healthier person at the end of that week, I really do think that mind-body connection makes a big impact on how the person responds to the treatment that we are able to provide. We absolutely ask that the patient joins us in the communication and talking to us about how the treatment's going and how they want it to go. There could be times they say, hey, what you're doing here feels really good, but look, it's just not quite hitting the spot. What if you moved over a little bit, or just can you change the pressure a little bit in that direction? And then they go, oh yeah, that's working for me. And so that sort of communication and that teamwork between the patient and the therapist is really important. And there shouldn't be an ego for the therapist treating. I think some therapists have an ego and don't like to be told how to do their job, but I can't feel what the patient's feeling. I get a response from the tissue, but if the patient verbalizes and say, look, that's just not 100% what I need, what about we try this, and we try it and we have a great result, that's what it's about. It's about the patient, and that's the kind of relationship that we get with the patients as we go. You know, definitely times it's quiet, it's more introspective, and there's silence in the room, and other times there's maybe a cathartic communication. The patient has a story that or stories that they wish to impart, and that just changes how they're seeing themselves and their body. And you know, sometimes there are tears, and sometimes there is laughter and some silliness, and it just all depends what the person needs.